everyone. Welcome to another episode of Information with Deidre, the Public Health Career Spotlight. I have another special guest. We have a hospital CEO. CEO is Chief Executive Officer, Mrs. Precious Stepney. Introduce yourself to the people.
Hi, greetings, peace, peace. So I'm Precious Stepney, and I am currently the CEO for a psychiatric hospital in New York State. And I'm really excited to share a bit about my journey. And, I don't know, we'll see what we get into. I know you like to ask some good questions, so I look forward to answering them.
Okay. So, as we said, you are a chief executive officer at a hospital. So, what do you do? What does that mean? What does being a CEO mean? That is the profession. What do you do being a CEO?
Sure.
To the good
So, so essentially, of course, I think, for the most part, we know that the CEO is ultimately responsible for everything within any designated organization. So for myself, being responsible for soup to nuts, everything that goes on within the hospital is what I cover. How I got there might be something that would be a little more interesting, right? Because I think we all envision ourselves being some sort of leader, right? We all have leadership qualities. And so, I know I strive to be the boss until I realized what that ultimately meant, right? Which is like everything sits right here, square on these shoulders. So I came into the healthcare arena through quality. So doing lots of data analysis, survey readiness, compliance, policy writing at the local level. So within the organization, understanding the trends, the trends in mental health and treatment, patient care needs. And you kind of pull that all together. And particularly as a quality director, when I was at that level, I got to interact with all executive leadership because you have to understand all of the standards across the spectrum. And so that was a great preparation ground for becoming a CEO, because you have to interact with all of the leaders and step in. And that's what I do now. I work with a senior level cabinet team. Sometimes they're called a C-suite or the executive suite. Even like if you think of the president, there's a cabinet. And those people are my kind of advisors, also the folks that kind of communicate the vision, like whatever my vision or the organization's vision is to everyone else.
Yeah, it's like that first level of execution. Like, okay, I need this to happen. And then go disseminate that to theirs. And then it filters on down the line till you see something come into fruition.
Yeah. Or the opposite, or this is what the team is seeing happening. And bringing it up the chain, to myself, and then problem solving and troubleshooting and really actively listening and assessing, how to best move next. Like it's definitely, when we think about being that CEO or stepping into that leadership role, or even being an entrepreneur and running your own thing, it's truly about listening way more than directing. So yeah.
When you're in leadership positions or when you're aspiring, it's something that you should know, but like you have to kind of be reminded when stuff starts happening. Like, you have to listen more than you can talk. Like the listening skills have to be like on par, because a lot happens at higher levels. And so you have to be sure that you're interpreting. So it's not just hearing, it's also like letting that go in, process, and then something useful coming out of here, and not just wah, 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 wah.
Yes. And not even always the spoken communication, right? There's so much in body language. I know as we were kind of in the backstage, if you will, just talking, one of the things you kind of posed was like, let's think about something kind of like tips, right? Or like juicy things. I'll share something and I'll just kind of pepper them in as we go through the interview. I have learned the most by watching the dynamics of the room. Not the folks necessarily sitting at the boardroom table, because oftentimes, there are, additional chairs around the boardroom that can't all fit at the table. I
Mm-hmm.
like watching the people in the back, or the
Yeah.
peanut gallery, if you will. They are the barometer for what is truly happening and what is truly not happening.
Mm-hmm.
Sometimes a director will say, "Oh, yes,
Mm-hmm.
that is really working well." But the manager will look down and be like, that's when you, as that leader, needs to kind of key in and kind of, even sometimes when the room is emptying out, say, "You know what? I want to come see your program." Because then they don't have to tell on their boss, but you get to see firsthand
Mm-hmm.
whether what you're told is really true. And
Right.
and that's important, because that is a part of being what I would call listening. Like, you got to listen to even what's not being said.
Yeah,
Yeah.
sometimes it's listening with the eyes. It's that EQ, emotional
It
intelligence.
is about it is about emotional intelligence at all times. Yes.
So tell us a little bit, and went dark. That's okay. So tell us a little bit. You did give us a tiny bit about how you got there, right? Your road there. I want to bring it to, like, this is really for students. So I have two kind of very related questions. So the first part is, what areas of public health is this covered? Because a lot of times when we hear hospitals, it's very clear it's health administration, right? But as a CEO of a hospital, and the type of hospital, which I want you to kind of go into, because we don't have to talk about which one, everybody, like, but they'll probably, your LinkedIn, I don't know. But, we don't have to, put anybody on blast. But the type of hospital you work in, which you can get into, that puts it in a very public health space, right? It's at that crossroads. It's health administration, and it's also public health. So tell us about the area of public health that it covers with regards to degree, and talk about yours, because we see your letters. And then, how it kind of intersects with an MPH. And then, like, your road as a student to kind of get to
Sure. Okay. So the area would definitely be behavioral health, right? So we know there is there, depending on how familiar you are with even the hospitals, right? There's ambulatory, there's acute care,
Mhm,
there's psychiatric. Those are just three, or slash behavioral health.
mhm,
Um, Historically, the terminology was, psychiatric hospital, and then it shifted to a behavioral health model, which is a broader model of really a clinical team coming together to help support and manage behaviors so that individuals can function
mhm,
successfully within their designated community and live fulfilling lives outside of the hospital. That's ultimately what it's about.
mhm,
So the area of public health would be behavioral health. And so I lead a team in a psychiatric hospital. I'm going to go into, since this is for students, I'm going to kind of go into the different tracks. So I have an MPA. So that's a master's in public administration. My undergraduate degree, my bachelor's, is in human services.
mhm.
So I actually intentionally did not pursue a social work baccalaureate degree, nor did I pursue an MSW initially. Well, kind of still finishing up an MSW, but so the MPA track is a public administration track. I knew that I wanted to work for a municipality or a nonprofit. So therefore, I want to make a distinction between the MPA and the MBA, and then get into the MPH. So an MPA and an MBA are very close, very, very similar. The primary difference academically is that the MBA focuses more on for profit,
Right.
and the fiscal management, and appreciating that you will have shareholders that expect you to account for your profits, right?
Mhm.
Now the misnomer sometimes with the nonprofit arena or the municipal arena is that there is no um, that we don't cleave to the budget, or that we are not looking to make a profit, or be profitable. That is grossly inaccurate, right? No matter what your funding source is, number one, you have to be accountable for how you're spending, and you also want to see positive outcomes. You want to see gains. Those outcomes may not be monetary, they may be patient outcomes.
Right.
Are we meeting our mark? Are we, are our clients satisfied? What is the voice of the customer? What are they saying about us?
Mm-hmm.
And then, of course, there are accreditation bodies that enter in, and they tell us how we're doing.
Mm-hmm.
So the big difference between the MPA and the MBA is one is for the public administration or working within a government or municipality, whether it's city, state, or federal.
Mm-hmm.
Um, or you can also go into that nonprofit arena.
Right.
Um, but the goal and the vision is still the same. You still have to kind of know how to lead an organization, understand how to implement organizational change,
Mm-hmm.
quality, all of that.
Yeah.
Now the MPH, uh, I found, and you can definitely tell me more of the MPH side because I'm not as eloquent there, but I do know that one of the bigger differences is that on the public health side,
Mhm.
your lens is much broader and more detailed into just health
Yes.
care, health dynamic, like
Yes.
community, disparities as it pertains to health. Whereas an MPA, I don't necessarily have to be in the health field. I could actually be in the administrative side of, let's say, the finance department
Yeah.
within New York State, right? New York State's finance department, and still function as an MPA. Whereas with the MPH, you wouldn't necessarily, find yourself in finance per
No,
se. Like,
no,
yeah.
not really.
not
Yeah.
on not on purpose, right?
That person is probably still going to be like have like a CPA,
Yeah.
or they will have a background in business. They might be an MBA. So
Mhm.
this is where some of the when you have a nonprofit that's health based or public health nonprofit, you will have that mixture because, like you said. It is called a nonprofit because our sole purpose is not for profit. It is the service that we provide. But we may not have shareholders, but we have community members, right? The community will tell us like how we're doing. We have the funder, right? And that's our marker. We also have board members. So there are, bodies that we have to answer to. And
Mhm.
you're exactly right. It is very broad, which is why we're doing this series to show people like these are the things that you can do, with a public health degree or a dual degree. Like there are people who have MPA, MPH, or MPH,
Yes.
MPA, or an MPH, JD, and things like
Or
that.
MD
And
MPH, because I
that's
have quite a few MD MPHs as well.
yeah, it's very, very broad. And like so this one, like because it's CEO, like so your position in particular, it is the ones that that I was explaining. Like so make sure you check out djselly.com and look at the blog post about this. And it's one of those positions that sit where I was talking about it requires like a very broad skill set because there are a lot of things that you can do with as a CEO, like, and not just broad, but like, it's specialized. So these are the people who have specialized different levels of skills as they've kind of built their career. So it's good for people to know, like, here's even like one of the upper, positions that they can hold, because we all sometimes start out with that grunt work job. I was speaking with one of my other guests. I was like, yeah, I have trauma.
Yes.
So remembering some of the things at the beginning.
Yes, that's right. And you did ask me about the road, right? The
Yeah.
road to see. So I'm happy to share. That road started with, let's see, it actually started with my associate's degree, field placement.
Okay.
And that was also in human services. And so I did a field placement with the Department of Juvenile Justice in New York City. And the director just kind of took a liking to me. And so once I finished the field placement, she offered me an opportunity to enter as a case manager. So
Okay.
working in Bushwick, Brooklyn, I had to work with youth who were being released from
Mhm.
back then the names of the facilities have changed. So I'm not even going to say the old names, but pretty much the youth that were being discharged from the juvenile justice centers and
Ruby.
work juvie.
Ruby. I remember.
So yeah,
Not,
each borough now. Say it again.
I
What you
said,
say?
not me personally. That's what I remember. I was like, it's
Not
not.
you. Not you. No, not you. Perhaps me. No, but not you. Um, yeah. And so working with those youth to make sure that they were, oh, this is another funny story. So working with those youth to make sure that they work their way back into their school, that they know that pretty much any support, any case management support that the family may need to ensure that they're never arrested or come through the juvenile justice system again. So a really quick, funny story there, just about being young and like going up to schools representing your client.
Uh-huh.
I'm walking through the school and the late bell rang and just we're walking,
Oh, I think I know.
face in hand, and this man walks up to me. He's like, "The late bell just rang. Get in the class." I didn't even turn around. I just held up my bag, my ID over my shoulder and stood there. And it was like, okay, just accept that, you look like a juvenile
Right. Like,
representing these challenged adolescents. But so I started at case
you're grown
management.
up.
I'm an adult, yeah. And by the way, can you tell me where the guidance counselor's office is? I'm here
Right.
for a meeting. But starting there, really, community advocacy, um, making sure that these youth were appropriately represented and sometimes protected. Because sometimes, we're given a label,
Mhm.
whether deserve it or not, we're given these labels, and then the opportunity to kind of shed them seems like you just can't. It's like elusive. You can't shed this label. And so my role has always been to be an advocate, and to use my big mouth for like helping others wherever I could. So I started in juvenile justice. I transitioned to corrections.
Mhm.
I worked on Rikers in what used to be called C-74, which was the adolescent building on Rikers Island. But I'll tell you another quick tidbit. It is not just the kids there, okay? It's not just the little guys there. It was also actually the something called the turnaround. The C-74 was a turnaround facility as well. And turnaround meant, just for y'all who don't know, uh, sometimes you think you're serving city time, and which means you have like I think it's up to 2 years. You can serve it locally downstate versus going upstate. And
And
then what happened? Say it again.
to Sing Sing upstate.
Well, Sing Sing is well, yeah. So anything outside of Rikers and like New York City corrections is considered state corrections, and upstate is Sing Sing, even though Sing Sing is not really a far upstate. Um, but yeah, then you go to a state facility. But there are people who would serve time for one thing at the city level, but have other cases pending and then get turned around. Literally, like your paperwork is turned around and you're told, oh, you're not going home. Like you served your time, but now you get hit with a turnaround. And so I would also have to provide case management like services and support to those individuals. So I was a civilian for quite some time on Rikers and C-74. That was very
So you
colorful.
got stories. We're gonna get to those because we're still in
That was colorful. So let's see. After that, I began to pursue my MPA because I had a lot of time when I worked on Rikers. And so I pursued my MPA, and then I went into the private sector. I worked, well, non-for-profit. I went to a nonprofit that was an Office of Mental Health license program. So it offered mental health services, residential treatment services to adolescents. And that's where I entered the domain of quality. and understanding licensing and compliance and risk management and doing investigations and things like that.
Yeah.
And that kind of led me to, you interact with licensing surveyors, and if they like what you're saying and they're doing, oftentimes they'll say, you should consider working where we work.
Hmm.
And so then my journey into New York State began in,
Yeah.
like I said earlier, the quality arena and doing survey prep and things of that nature. Mm-hmm.
And
Mm-hmm.
so with that, the quality piece, because that is a key piece of public health, is that like also like that evaluation. So it's like we're doing all these stuff and we're working and we're doing, but then we have to stop and say, what does it mean? What has been the outcomes of what we're doing? And are we efficient at doing it? Are we effective at doing it? Which is also that research piece, right? That people have to be like really in tune with. Like research is like very laced throughout all pieces of public health. Like I think it's like no matter where you go, you're always going to be hit with the research piece. So get used to it, folks. Can you talk a little
And
bit about?
that research piece is so valuable because
Yeah.
that is what truly informs the
Right.
trends or the needs of tomorrow. So if we're to
Mhm.
think about, let's just bring it to what's happening right now. I'm often like thinking about how our children will be impacted by this time of being locked in the house.
Yep.
How are socially,
Hmm.
what did this do to a generation of children? Think about, I mean, people are going through and experiencing, second year graduations. Now, last year, this time, you knew for sure you were not having a graduation ceremony. But this year, there are some schools that are having a structure where you come in with your two parents or whoever, your two loved ones, and you walk and you get a photo and you move on. Some are completely virtual.
Yeah.
How does that impact one's? There's a certain kind of, you kind of cleave with certain pride to having this experience because we're
Yeah.
told this is a part of the collegiate
Right.
experience.
It's that
So,
passage for that,
yeah.
arena. And you are
Right. And
the
so when we think about the impact, there's got
yeah.
to be research that's going to kind of happen to inform that. And that's just really anecdotal, like benign things, but there are major things happening that research helps to inform.
Yeah.
Um, yeah,
So
yeah, yeah,
much
yeah.
coming out now with regards to how COVID put a wrench in everything. I mean, they think, like you said, anecdotally, we already know, but the research gives us a concrete idea or concrete evidence, right? Because that also goes into what we say in public health. When we say evidence based, it means it's the research. And so, in order to get that evidence based information and data, you have to have that evaluation, that monitoring and evaluation piece, and then
Mhm.
disseminate it appropriately.
Yeah,
Yeah.
yeah.
I'm
So
gonna
I'll go ahead.
I'm gonna take a pause. I just want to acknowledge the chat. Greetings, Chief Yuya. Thank you for stopping by.
Mhm.
Toda, to everyone, greetings, Sister Kashia. Greetings, Sister Munira. Greetings, Brother Christopher. This is so exciting. I'm so happy to have all of y'all in the space. Greetings, Sovereign Eats. How are you? So please make sure you ask your questions. Our guest is here, but we're not breaking HIPAA rules. We don't want the hippo to come after us. But we she is here to answer questions about being a hospital CEO and what that entails as far as careers and also for students. So if you are catching this after the live, please make sure to put your questions below, and I will, as always, try to get to them.
Mhm.
So we covered a lot, like even just or in our organic conversation. So we talked about your career path and like what you majored in, and tell us about. And this could be like I don't know, juicy. I don't know, a day in the life of a CEO.
Mm.
And what would be, and whatever, whichever one you think is the most interesting, because I think like you probably had like a lot of us who were fortunate enough to, you know, maintain some source of income and been able to have that like work from home or work from anywhere type of deal. So that's kind of like, yeah, I got up and I went to my home office and then I was on the computer for 8 hours.
Right.
so so I would say pre-COVID, those in the field on the office days.
Well, I'll do you one better because I think it's important for, I'm going to do you one better because I think it's important for those listening, as you said, your audience, or, really this is to edify those who are exploring different career paths. I'll share a day in the life, like today, or a recent day, because for one, no, I am not. It's a hospital. We run 24 hours. There was no closing because the world closed. We were up and out in the street driving to work every day. So that's one thing, right? Because as we know, it wasn't just the nurses and doctors that were considered essential workers. It was the executives, it
Yeah.
was the cooks, it was the housekeeping staff, and I mean, nothing gets done without food services and housekeeping. Nothing. And that's really, really important to recognize because they're often the unsung heroes, as well as the direct care staff that work, particularly in the mental health field that work directly with the patients. Their needs are met 24 hours a day.
Yeah.
So, a day in the life of a hospital administrator with any title definitely begins with morning rounds because there are at least 3 shifts in a hospital, or the max of 3 shifts. Yeah, there's always 3 shifts. Sometimes there are two for nurses. It could be 12-hour shifts, but you're always doing a warm handoff. I always need to know what happened the previous day, what codes there were, what incidents there might have been, where the fires have been, because where the fires were yesterday.
Explain what you mean by code for those who
Oh,
don't.
sure, sure, sure. So
Mhm.
in a hospital, there are codes. So a code is an announcement that you hear over the loudspeaker that you may not understand because it's in code, but those of us who have been oriented know what they mean. So for example, in a psychiatric hospital, or I'll just say in my hospital, we have 40/40, which is a medical emergency. We have a 30/30, which are psychiatric emergencies. There are also 20/20s, which are psychiatric emergencies in our outpatient setting, which is on the campus. So my particular campus is a 40-acre campus that includes an inpatient footprint of about 160 patients that are secured within the hospital. We also have 196 396-bed residential programs that are on the campus. And those are folks who are discharged from the inpatient hospital that live in their own, or usually a shared space, in a house. So they're preparing for apartment living. And then there are also a myriad of clinics and community services that are off of campus. But on the campus, there are also lots of substance abuse treatment programs, and that all kind of falls under my domain as far as making sure it's all safe. So we have to respond to codes. And of course, there's a safety department who helps to support that, and the clinical team who definitely ensures that if there's anything acute happening, and a medical team, they can respond even before 911 responds. So first thing in the morning is morning rounds. And the composition for morning rounds is always going to be the cabinet, myself, some of the clinical leadership that work overnight, right? Because there always has to be a physician on staff to respond to any emergency needs. So there's always, of course, there's always the nursing staff. They're always present. But there's an on-call physician, on-call medical physician, and an on-call psychiatric physician. And they just provide some context for anything that was done the night before. Lots of meetings, lots and lots of.
How about meeting?
I love it. I love it. I love it.
Yeah.
Today, let's see. Today, I think yeah, a lot of problem solving and people bringing things to you that they otherwise could not address or want to be sure that they're moving in the right direction. So I think the thing about a senior level leader, particularly when you're no longer within a specialty, when I was quality, I was the quality director. I had to know everything about that. But if you spoke to me about a clinical need, I was
Right.
like, clinical director, see the
Yeah.
director of psychiatry, or see even the chief nursing officer. But when you are the CEO, when you are the executive director, some places you're called that, you're given that title.
Right.
Everything comes to you. So there, you consult with and you get feedback from your leadership team, but ultimately you have to have your finger on the pulse of what's going on within
Yeah.
your organization and around your surrounding your organization. Yeah. So a day could be meetings, a day could be discussing policy changes. Oftentimes I'm reminding myself about what the strategic planning goals are. So what are our overarching priorities so that we don't get stuck in like knee-jerk reaction and crisis mitigation, if you will. Yeah, things will always come up and there will always be an emergency meeting, but we still have to have that long range vision of where we want to see, how we want to see this organization moving
Mm-hmm.
um, day to day, and keeping that at the forefront of your senior teams, your leadership team, and middle managers' mind. Um, Lots of what we do is also empowering the middle managers, making sure that they have the tools that they need, and the autonomy
Mm-hmm.
to execute
Right.
successfully, because sometimes that can be a stumbling block to successful outcomes. You know, they
Yeah.
say what is the saying? The cream rises to the top, but you know what? You're only as good as what's coming up, because of what's coming up is disempowered and rocket, but which it did in some facilities, but it didn't, thankfully, in ours, because one, there were weekly town hall meetings to share very honestly, these are our COVID numbers. These are, this is where we stand with PPE, which is personal protective equipment, right? And PPE includes masks, gloves, gowns, goggles,
Mm-hmm.
yeah,
Standard
booties.
for a hospital, but it just
Standard.
always
Standard for a hospital, but very, very hard to get during COVID,
right.
even for city,
Became like
state, federal.
this commodity, and
Listen,
everybody needed them.
listen. Yes, Purell was like money, okay? It
Gold,
was
like
like
Clorox
currency.
wipes, Clorox
It was
wipes.
currency. It was currency.
Mhm.
Um, but a day can be very varied. I think the being fluid, being able to kind of roll with whatever comes is really key to any leadership, and keeping that long range vision.
Mhm.
Yeah.
Yeah. We have a question. I have two questions for you, but those we'll save to the end because I have a few questions. Like you said some things, and I'm like, oh, I wonder about this. But I'm gonna go to the chat first. So Munira says, is it difficult balancing home work life running a 24-hour facility?
Yes, this is where teamwork,
Short
the
answer.
dream.
Yes.
Yes. So, yeah, I'm also a mother, and many other things. And so with that, there is a challenge. And the challenge is not it is challenging, but you have to recognize and acknowledge that the challenge is creating balance.
Right.
So yes, I have a work cell phone, and yes, it's 24/7. But there's also a leadership infrastructure, right? So we have administrators on duty that check in on the off shift and report out any major concerns. My senior cabinet have administrator on call rotations. I, of course, am on call 24/7. But there are layers that kind of create an opportunity for balance. Things do happen, things do come up. Surveyors do show up at 7 o'clock in the morning, and you think you can just brush your teeth and get to work. And it's like, everything has to shift and change. But again, you just remain fluid and build a good team. I can't tell
Yeah.
you how important it is to be able to recognize the strengths and challenges of an
Yeah.
individual and really work that,
Mm-hmm.
cultivate that with them. Acknowledge recognizing their challenges, but not
Yeah.
necessarily in a punitive way, but in a way where it's like, okay, I see that, getting here on time may not be your strong suit, but these other things are. So let's see how we can make sure we put some fail safes in place when I need you here, you're
Mm-hmm.
here. Just really being flexible
Yeah.
wherever you can.
And
Yeah.
that's a skill too, right? Like, like, I mean, because like how many of us are familiar with the criticism sandwich? It's like everybody knows that now. So it's like, what are some constructive ways that people who are leaders or who have staff to be able to do that? And you have to use that EQ, right, to be able to manage a team. And I remember like doing like a presentation to a bunch of high school girls, and I was like, managing people is one of the hardest things you will ever do, because not only are you managing your own self and your internal and what does that look like on the outside, but you're also having to process everything else. And that's a skill that is definitely, not everybody hones it, because we know there are some bad bosses, but it's a skill that's needed, the higher up you go. And
Mhm.
also that delegating. So like, even to when there was question about balancing the home work life, it seems to me like delegation has to become like something that is second nature. And I even know myself, I've had trouble with like delegation. I'm just like, I got it, I'm gonna do it all,
Yeah.
finish, or when I finish is when I finish, and you'll get it, you gotta
Yeah,
delegate.
and that's the recipe for hypertension and
Yep.
super strung out and stressed out. And
Right.
and then what kind of, when you speak about, emotional intelligence, then where does that leave you,
Mm-hmm.
spent? So then when those emergencies that were not scheduled show up, you already stressed out because you didn't delegate, and you have all these things deadlines that you must meet.
Yeah.
Delegating is, and thank you for, it's so inherently a part of what you have to do as a CEO that I forget to even mention it. I receive some question, inquiry, a letter saying XYZ needs to happen within your organization. And my first thing is, hey, heads up to my DQ, heads up to my director of quality improvement, looping in my clinical director or the operations director and relying on their expertise. How can we get this done? Is this doable? Or sometimes it's literally, especially to my finance, my facilities person, what in the world is this?
Right.
And not being ashamed of saying, okay, so can you decode this for me? What do we need
Mm-hmm.
to
What does this mean?
Right. And
Like,
trusting that,
like,
they are the content expert. Like, as
right.
a CEO, you are not expected to be, I am not expected to be the content expert, because guess what? I'm not a psychiatrist. So I should not know from an expert perspective, the appropriate way to titrate medication for a particular patient to
Mm-hmm.
get them on level where they're responding appropriately to the medication, which is what titrating means, like going up or down incrementally. But you do need to know more than enough about everything that goes on within your hospital,
Yeah.
that within your organization. You have to know. You have to
Yeah.
know whether the information that you're being given is a little bit questionable or on point.
Yeah.
That you do have to know.
Yeah. Someone once told me, like, you don't have to know everything, but it's good to know a little bit about a lot. And I used to hold that with me a long time. I was like, know a little bit about a lot. But sometimes I realize, like, there's that little bit is not enough, right? So to your point, like, when you're in an organization, there's levels to that little bit. Maybe you
Yeah,
need to know a little bit of this over here, but you need to know a little bit more about this over here. So you
absolutely.
have to, like, gauge what your level of knowledge and wisdom and understanding should be about all those different levels, so that you can delegate appropriately, know which questions come to you. Like, these are things that I had to really, like, hone in on during our year of confinement, which we're still in.
Yeah.
And it's like, we're gonna have some professional development. And it's like, we're gonna make these work groups work, and you're gonna do this. Like, you're gonna have more autonomy to do X, Y, Z, because I can't
Mm-hmm.
handle it all. And, like,
Mm-hmm.
we'll have some, like, upcoming movements, like, personally, and I'm like, I won't be able to handle all of that. So we're gonna have to release something. We have to bless and release some things, and, like, trust comes into it. Trusting your cabinet, trusting your team,
Mm-hmm.
so that they're, because even in that level of trust, people sense that, and then they'll want to do a good job. They'll want to do it, right. So yeah.
Yeah. So much is about trust and relationship building.
Mm-hmm.
The way I've gotten to knowing a little bit about everything and a lot of it about some things is by cultivating relationships, being approachable, being able to keep things in confidence, but still addressing concerns. You know how many times people come and snitch and they come straight to me, but I can't
That's so
say
hard. It's just like,
they
oh,
came to me
no.
all the time. Oh, I'm walking to the parking lot. I'm just trying to get to my car to go on home. And it's like, Miss Stepney, let me tell you, you need to come see the third floor inside the kitchen. This didn't happen, that didn't happen. But you know what? Number one, I value and appreciate the level of commitment of someone to put themselves out there to tell me this
The
thing is not right.
whistleblower.
Because
That's
you know what? They get to go home. So it's not right for our patients. And they
right.
care that much that they want to ring the highest alarm they can ring within the organization.
Yeah.
When that happens, you just do, what is it? Management by walking. You just walk
Right.
up in there and say, you know what? I wanna take a tour today. I wanna
Watch
go.
the
Can I go to
scramble.
that third floor kitchen?
Watch the scramble.
And you bring the facilities director with you. Let's go for a walk. Let's see what we see today. Because oftentimes things are just hidden, or someone fails to put in a work order. Sometimes it's just as simple as the work order was put in, but nobody said we were waiting for the part. But
Mm-hmm.
having the relationship where people know they can come and talk to you, where open door truly means not just that your door is open, but here's my phone number, absolutely call me. No, you don't have to have a meeting, stop by. It's better, you don't want to wait to see me, but to really just be accessible. I found that to be, yeah, really, really some of the keys to knowing what you otherwise would never know,
Yeah.
because you're running the organization, but the folks doing the work, they know.
Yeah. It reminded me of, like, JACO, because you talked about having to answer to accrediting bodies, and then, like,
Mhm.
your comment just now with facilities. I'm like, it's like that scramble, like, JACO's coming, and I don't miss that either. I don't miss it. Like,
Yeah,
getting ready for JACO visits, it is a big deal in hospitals. And yeah, you just reminded me of that. Like, what are those like? Like, preparing for
sure.
JACO, and you and explain what JACO
And
is.
I'm gonna explain. And I definitely know that you haven't been in a hospital in a while, because
Yeah.
they're no longer called JACO. They're
Oh
called
wow.
the Commission. Yeah, they changed their name about a long time ago.
Yeah.
So, yeah, yeah, yeah. So the Joint Commission is it's actually an international accreditation body that, well, for in the United States, they take the Medicaid and Medicare, so CMS, which is the Center for Medicaid and Medicare Management Services. They take the CMS regulations, and CMS determines billing, standards of care at the federal level, and
Right.
then that trickles down to the state and city level.
Mm-hmm.
And what the Joint Commission does is they have created a set of standards, and what they do is those standards are based on the CMS regulations. And every hospital has to be accredited. CMS has made it such that every hospital has to be accredited by the Joint Commission. And which means you get a triannual survey. It is an unannounced survey. You have an 18-month window in which you should expect a visit, but it's never really, sometimes they come very early. But survey readiness is all year round, every single day. And that's what they expect to see. So while there is the Joint Commission is coming, or the joint is coming, oftentimes my perspective when I was a quality director, and even now, is that we're always in a state of readiness. I should never
Stay
walk
ready.
onto the
Gotta
unit.
stay
Oh,
ready.
hell,
You gotta get ready.
stay ready, because when I come stomping through the units, like you don't, I'm worse than the Joint Commission, okay? Because I know what should be happening, not just from a joint perspective, but policy wise, like internal policy, state
Yeah.
policy,
Mhm.
best practice perspective.
I know.
I Right. Right. And you were at the table advising it. So why is it not happening? So making sure, so the Joint Commission preparedness is definitely an experience. But I think what is more valuable than even the visit is how you prepare your hospital for the visit. Because the way that I find most productive is really to create a rally around positive outcomes, quality indicators, and open access to information. Giving people the why. A lot of times we're given policy and we're told, do this today, and now no more blue pens, now it's black pens. But you never quite articulate the why. And for clinicians in particular, they don't often see value in policy change, because you know what, they do what they do. They assess their patients, they
Yeah.
follow the medical model for care,
Yeah.
and ain't no black and white gonna tell,
Right.
no black piece of paper or policy gonna tell me how
Yeah.
to, right?
That
But
administration. That's you. I'm
yeah,
clinical. I deal with the patient, and this is what
right,
I'm brought here to do.
right. So you figure out how that happens. Now, the thing is, when you give them the why, when you actually share the Joint Commission standard with them and you break down how it connects to more positive patient outcomes, or a healthier a more healthy environment for them, or a safer environment, right? Because we haven't spoken at all about the inherent risk of working with their persistently mentally ill. But there are acts of violence that happens when a patient isn't appropriately medicated, or where they're no longer responding or cheeking their meds, which means not taking them but storing them in their cheek. Um, and so there are times where we have to do a treatment over objection, or an emergency appeal to treat an individual over their refusal to be treated. And that's more of the legal side of things, which sometimes, you may not even consider. But there are ethical and legal nuances to what we do to preserve patient rights, because even though you suffer with chronic mental illness and you may be voluntarily in a psychiatric hospital, there are times where it can go from voluntary to involuntary
Right.
based on the clinical decisions,
Yeah.
or recommendations, based on your clinical presentation. So
Yeah.
that's the tough part of the job, making really being earnest about assessing who's a great risk to themselves or the community, and require the level of care
Yeah.
um, that would preclude them from being just discharged because they want to be. Yeah.
I'm glad you said that, because I think a piece of public health in general, right? Regardless of what letters you hold, when you're in that space, you automatically become an advocate, whether it be for like internally, which when we kind of discussed this even with the very first spotlight with Aquia, the traveling nurse, you become that advocate like for your team, the staff, like the workers, the advocate for the patient, because not just like when we're talking about people to answer to, it's like how are we meeting objectives, what are our outcomes? So you have to kind of be that advocate, even if you're like in a nonprofit. You have to be that advocate for the community you serve, because even as a hospital, and as you mentioned, specifically a psych hospital, there's patients and you are actually sitting within a community. When you have like the physical building, it has to sit somewhere. And so it's like, also, how are you being mindful of like, what's happening on the outside of the space, and how it affects the inside and vice versa? Because like you said, you have people who are also working on transitioning, returning like back to the community. So there's always that level of advocacy that is present. We have a comment. Ipako Bahamas says, the why, I hear some Shima discovery talks in there. How you do one thing is how you do all. Preparation is key. Yeah, yeah. There's a lot of preparation that has to happen. And a lot of that comes with like the listening, so that you, like you said, if you stay ready, you ain't got to get ready. I mean, sometimes you have those outliers and you're like, but
We
there's a
ain't
lot.
ready. Right.
Right, you do have those moments, but you got to stay ready. Yeah, I have a question, and you kind of touched on it because like we've been here for a while, so I'm gonna like wrap it up a little bit. What are some pros about like being a CEO, whether it be like in the current position now or just in general, and something that you wish you could change?
Sure. So, being a change agent for me is extremely fulfilling. And being at the helm of supporting the vision, whether it's not always originating with me, right? The vision can come from data informing us that we need to make a sharp left. Or perhaps it is just recognizing that there are certain changes. So I think one pro is being at the helm. You really have the autonomy and the creative resources to be creative. I appreciate that. I also like being in the position of a CEO to give opportunities to those who otherwise may not have had them. One thing that I have always been committed to within my career is training, up training, giving as much information as I have and sharing as much information as I can share, to ensure that you get wherever it is you want to go, not holding you back because you're good and I just want you to stay working for me. Um,
Yeah,
I've
a lot of that.
Yeah,
I like to see people succeed. I've had good people leave me, and I'm like, "You do you, boo. Go do it. I'm
right,
at your
right.
back."
Go, right, go,
Mhm.
go. Tell them I sent you too. No, but I think that that's really some of the pros. Also, just seeing how a patient can come into the hospital completely out of sorts and watch a clinical team rally around this individual and reconnect them with their family, and and get them into community housing and have them working or even coming back as a peer to mentor some of the other patients is very, very fulfilling. So those are just some of the pros.
Yeah.
Um, the pay is also pretty cool. So I want to acknowledge that, right? It is. It's a pro. It's a pro. Like, continue, work hard for the if that's the track you're on.
Mhm.
Be very intentional. Like, look up what you would receive career wise for a particular degree that you're planning to pursue. Don't just say,
Yeah.
I like art, I want a degree in art, and then not
Yeah.
know how if you're concerned about being compensated,
That's
not know how you'll
true.
get compensated.
Yeah,
Um,
because if you find that it was supposed to be something different, when I say trauma, if that is your priority, because it's not the priority for a lot of us. Some of it really liking to help people, and like you said, like I've seen that, seeing a team rally around. I've been part of that, rally around a patient and everybody like a bee in a hive. Everybody
yeah.
has their job and their piece, and it's like they're doing this to see the patient succeed, because when they succeed and they get better, we all succeed.
Yeah, absolutely. Something that I would Change. We talk about healthcare equity. The criminalization and the institutionalization of the mentally ill is still um, really, really just a gross misservice or disservice to that population. At least I know in New York State, some of the laws have changed that has kind of curtailed some of the criminalization for the mentally ill through reform of the bail system and
Mhm.
process, and that's phenomenal. But there's still a lot of work to be done to preserve the rights and the dignity of the mentally ill, particularly the persistently, ill, because their presentation is much more challenging to the it's just more challenge, not even to the untrained eye, but to all. And so just understanding how to be a support for those individuals is really something that we haven't mastered yet
Yeah.
as
Mhm.
healthcare providers or
Mhm.
as a society. It's still
Yeah.
very unknown and scary at times. We
Yeah,
don't treat
because
mental illness. Go ahead.
we do this a lot.
Yeah, we don't want to see, and also we don't, I'm talking about those institutionalized at the state level, which means you really are challenged with functioning in society. But the reality is the majority of the population that suffer with mental illness still function in society quite efficiently and effectively with, going to clinic appointments, seeing a treatment team, and sometimes medication interventions,
Mhm.
sometimes not,
Yeah.
sometimes just other therapeutic modalities. But even those folks, when they have when they cycle, because when you have health conditions, even diabetes, you cycle. There are times when you'll have experiences where you're not responding to your meds, but your loved ones recognize, oh, you're lethargic. Oh, you're using the bathroom a lot. This is happening, that's happening. Maybe you're experiencing enuresis, and they know your blood, your diabetes, your blood sugar levels are off, and they
Mhm.
help you. Now, when someone is suffering and experiencing a break, oftentimes we throw a blind eye, we don't answer the phone, we don't necessarily support our loved ones when that happens, and that has to change.
Mhm.
The mental health and supporting positive gains in managing symptoms has to be normalized a lot more than it has been. So I'll get off my soapbox about the normalization of mental illness and
That's
just say
okay.
that hasn't
That's okay.
changed.
Edifying. Two last two questions. Ipako Bahama says, to date, what has been one of the most fulfilling moments of your time serving as in your capacity as CEO?
Having the opportunity to lead my hospital through the COVID pandemic.
Okay.
That watching watching my folks show up every day, work as a team, not complain. They were as afraid as everybody else was, but they still showed up. And my leadership team really being able to come together and galvanize and do things like create a wellness center and give them opportunities to create respite within the hospital, knowing that sometimes they didn't get to go home, not just for 2 shifts, but to sleep on the third shift and work again first shift. um, that was really fulfilling, because that reflected the fact that we're here not for the paycheck, but because we care about patient outcomes and
Mhm.
making sure that our people are good. Yeah, so thank you for the question.
Yes. Last question. What advice would you give an incoming MPH, MPA, MSW? What was the other one? There was a fourth one. I don't know. What would you give? What advice would you give a student coming in
Mm-hmm.
where whose goal is to be CEO?
Huh. I would actually venture to say, have your long range goals, but really take every role, every opportunity from your field placement very seriously. Know what your long term vision is. If it's CEO, fine, it's CEO. But don't necessarily poo-poo those other jobs, those other tasks, the feedback you'll receive while you're climbing that ladder. Also, be kind always. That is not my quote, but I'm gonna tell you that was something that I found is there's nothing like it because the world is so small. Like your professional arena is so tiny. You'd be
Very.
surprised how many times someone that you were not kind to is sitting
Mhm.
across the table
Yep.
or happens to be on the phone with someone like myself or like you, Deidre, and it's like, oh, do you know so and so? Yeah, I
Yeah.
do. What is
Uh-huh.
that person going to say about
Yep.
you?
What's
You're going to
going
say, oh, they're wonderful.
That's how you get jobs.
Yeah,
Yeah, that's how you
or
get
not.
or
Or
not.
not.
Right. That's how you get opportunities.
Because
Like,
you're always going to phone a friend. You're always
mhm,
going to phone a friend. And
nice.
you want your reputation to speak for itself. So make sure you're putting the best you out there and take every opportunity very seriously.
Yeah.
Um,
That's,
and I want to share one other thing.
mhm.
I don't want to go on too much longer, but you touched on having bad, we've all had the bad supervisor. I had some really crappy supervisors early on my career. I had some phenomenal ones, but also some not so great ones. And there
Mhm.
was one in particular that was an information hoarder. He actually hoarded everything, including like office supplies, and like would be the only one with the key to the cabinet for pens. But what I what I took from that was that even those bad managers are teaching you a lot of what not
They
to do.
are or what not to
So
do. Mhm.
take that, and then
Yeah.
you personify the opposite of it, right?
Mhm.
So that those are the things that I would
Yeah.
and try not to be in it for the money. Like know that where your passions lie, you'll be compensated because you'll be fulfilled and fulfilling. Yeah,
Yeah. Because
that's
everything is
it.
yeah. Thank you so much. That is
My
awesome.
pleasure.
I have to close on that. So we will close on that. Greetings, Aquia. You might have missed it,
Yeah,
but you can check out the replay. You can check out the replay. Thank you so much, Precious Stephanie, our
thank
hospital
you.
for joining us and giving us some insight into what it's like and a day in the life and like how you got there. Really appreciate it. So as I said, if you're catching this afterward, do not hesitate to put questions and comments in the chat. We'll be checking them if they're specifically for Precious. She can answer them, or I can tell her like you got a question, but we will definitely be checking on them. And you can reach out to um, me for any information with Deidre and the Public Health Career Spotlight. If you'd like to see a specific person or recommend a person, you can reach out to me either on Facebook or at deidresully@gmail.com. Precious, if you want, if you want to share, Precious is also one of the co-hosts of True Health Live. So Easter egg.
Sure. And if anyone wants to reach out to me, the best way would be to message me on LinkedIn. And it's just Precious Stepney. Or you can also reach out to me through Instagram, and it's Precious Stepney MPA. So keep it simple, right?
Keeping it simple. Okay, so until next time, thank you. We will see you. Our next information with Deidre will be Tuesday, and we'll let you know what we'll be covering. Thank you for joining us. Peace to everyone in the chat. Thank you for joining us. And we'll believe this information because it was a lot. It's very helpful for you in learning more about public health. Peace.
Peace.